Discirculatory encephalopathy. Discirculatory encephalopathy refers to a group of clinical symptoms of chronic brain dysfunction that occurs due to pathological decreases in cerebral blood flow. So let's look at the etiology. The main causes of the onset and development of discirculatory encephalopathy are arterial hypertension and atherosclerosis. For the main reasons, the following types of discirculatory encephalopathy are distinguished. Atherosclerotic, the great vessels of the head are more often affected. The hypertensive, mixed, venous, and due to other reasons like vegetative vascular dystonia, rheumatism, vascular lesions of various etiologies, systemic hemodynamic disorders, blood diseases, and others. In practice, atherosclerosis, arterial hypertension, and their combination are of the greatest etiological importance in the development of discirculatory encephalopathy. The pathogenesis, it occurs in 3 stages. First stage, subjective complaints of decreased memory, attention, performance, dizziness, unsteadiness while walking prevail. Second stage, subjective complaints intensify. There are signs of lesions of the pyramidal tract, sensory disturbances, cerebral and cognitive disorders. The third stage, the degree of existing violations is increasing. Criticism of their condition sharply decreases. Patients become dependent on others. The clinical picture. The main clinical symptoms are distinguished as cognitive impairment, motor disorders, psychopathological, pseudobulbar syndrome, and pelvic disorders. The manifestations of vascular pathology of the brain directly depend on the depth, area, and topography of the vascular lesions, and as a consequence, nervous tissue. The age of the onset of the first clinical signs is between 55 to 75 years. The disease affects women and men to about the same extent. In some cases, there is a slow, gradual, or step-like progression of symptoms. In others, it alternates with periods of cerebral circulatory disorders, usually occurring in the type of transient ischemic attacks and small strokes. There are periods of stabilization and even improvements, usually associated with adequate therapy. The treatment, discirculatory encephalopathy caused by hypertension responds well to treatment. At the same time, therapy is aimed at lowering blood pressure by 10 to 15%. Lowering blood pressure to normal is not recommended to avoid insufficient blood supply to the brain. Thank you.